Good afternoon, everybody. Welcome to our virtual client town hall for the Canadian Mental Health Association, Peel Dufferin. Super glad that you've been able to make it out today, whatever you're doing. We appreciate you coming to learn more about what's going on with the agency right now. Just before we get started, I did want to let people know there is a question and answer function. So at the top of the screen, you should see two little squares with a question mark in it. And there you will be able to put your questions, check them out and send them. And we will be able on our end to see them and to respond. We are going to get to all of them hopefully at the end. So please put them in throughout the whole presentation, and we'll get to them at the end if we haven't already answered it. So please do use that, as that helps us to interact with you and to know if we're missing something that you did want some more information on. Before we get started further, I'm going to introduce David Smith, the CEO of CMHA Peel Dufferin.
Good afternoon, everyone. Just want to say hello and thank you for taking the time to join us. It's a little dark in my room here, so if you're looking at the picture at the bottom, I'm not sitting in the basement. It's just too bright outside. So I want to say welcome and thank you so much for bearing with us over the last few months as we try to adjust our services and support people as in the best way that we can, given the obvious challenges of COVID-19. This is certainly something we've never seen before. So thank you for your patience, and I look forward to hearing your questions and your reactions to how we're doing throughout the day. Thank you.
Awesome. Thanks, Dave. And just as a forewarning, we are using technology and we're hoping that there's no glitches. We are doing our best to keep swapping through so you guys can see all of us who are speaking. But let us know in the chat if there is something that's going wrong on your end. So this presentation, we're going to provide some information on COVID-19, probably things you might have heard, maybe something new. We're going to talk about how our agency services have changed with public health guidance and talk about really what do these changes mean for you. So at CMHA Peel Dufferin, our goal has always been mental health for all. And during, of course, this unprecedented global pandemic, we have changed our model of care so that we can support clients, families, and our whole community in accessing mental health and addiction services. So we are taking every opportunity to learn, consult, and seek guidance to ensure the well-being of clients, families, and staff. And the health and well-being of our staff and community continues to be our top priority. So this is a graph that we wanted to share that really shows, well, it's for the region of Peel and Dufferin-Wellington region, because Dufferin and Wellington are conjoined. So this shows that there is a steady decline, as you can see, in reported cases of COVID-19 in our service area. So this is a graph that's new daily reported cases per day. So you can see that there is that decline, which is good news for all of us. And this is, of course, due to the efforts of everyone in following physical distancing and personal hygiene recommendations. So just talking a little bit, I'm sure this is a lot of a recap for some people. How is COVID-19 spread? Primarily, it's from person to person. So thinking about droplets that are released when someone is sneezing or coughing, and how that can land on the mouths or noses of people nearby or passing through that area. Of course, close contact with someone who is sick, like hugging or shaking hands. Those are the main ways that it's going to be spread from people. As well, it can also be left on objects and surfaces. So if you touch something that was contaminated and then touch your face or someone else's face, you might be able to catch it that way. So thinking about doorknobs, laptops, elevator buttons, all your phones. I know I'm touching my phone a lot, pens, pencils, all that kind of stuff. So those are all things that we've taken into consideration moving forward. So you will be able to see what we've done for that. And we do, of course, want to keep preventing the spread, and that's why we're still going with public health guidance about practicing physical distancing. And so the goal of physical distancing is not only to eliminate the risk of catching COVID-19, but to reduce it, right? That's our main goal throughout everybody that's kind of working on this. So avoiding crowds, keeping that 2-meter distance, and wearing masks. Those are all things that will continue to help in the physical distancing to reduce that risk. So there are, of course, other ways to prevent the spread of COVID-19, and I'm sure a lot of you are doing these practices as well. So cleaning your hands often, coughing or sneezing into your elbow, not into your hands. Avoid touching your eyes, nose, and mouth. Limiting social gatherings and any time spent in crowded places. Avoiding close contact with someone who is sick. And cleaning and disinfecting frequently touched objects and surfaces. Thinking about those doorknobs, our phones, tables, laptops, those kinds of things. And so these images here, they show us proper use of wearing a mask and how to put it on and remove it as well. So we thought this was a really helpful graphic just to kind of show that there's a lot of steps in this, and especially as we're going to talk more about what's going on with our agency and wearing masks, and as now it is a bylaw in the Peel region to wear a mask inside public places. So you see that you do have to wash your hands before even touching it. Right, looking to make sure there's no holes or tears, finding that top part where that metal edge is, and ensuring that the colored side, so usually blue, is on the outside. Putting that part, the metal part, on your nose and making sure that it's tight there, and covering your mouth, nose, and chin. So making sure it's entirely covering everything there. Adjusting it to your face so that there is not a lot of gaps around. And we want to avoid touching the mask as well while it's on. When you are taking it off, you're just grabbing those loops there, and we're going to be discarding of it in the garbage, trying not to touch other things with the mask as well. And washing your hands, of course, afterwards, as that is a huge part of the prevention of COVID-19. So our next thing that we're going into, I'm going to have Lisa Ali come up, and we're going to talk about kind of our response. Do we have you there, Lisa?
Hi, I'm here. Thanks, Charlotte.
No problem.
Good afternoon, everybody. My name is Lisa Ali. I'm the Senior Clinical Director here at CMHA Peel Dufferin. And I'm here to talk this afternoon about how we have responded to COVID-19 in terms of the services that we're providing our clients, and then also to talk a little bit about how do we plan on opening our services as we continue to see changes in the number of new cases with COVID-19, and how are we going to get back to, I think, what some people are calling the new normal. So when COVID-19 hit in mid-March, how the organization responded was we had to decrease our face-to-face interactions with our clients. And so we were really only seeing clients who it was absolutely critical to see. As Charlotte had mentioned before, that face-to-face contact with people is one of the ways that COVID was spreading. And so we needed to make sure that we were providing our services safely for our staff and for our clients. So we really had to reduce the number of face-to-face interactions. We had the great fortune with the support of our IT department to be able to enhance our services virtually. So when we look at, and I think Tajman's going to talk a little bit, one of our managers is going to talk a little bit later today around the number of people we were able to serve during COVID through our virtual platforms. So this is either through telephone or OTN or even Teams like we're doing today. And we had to close down most of our sites so that we could control the people who were coming and going in our offices, again, to prevent the spread of COVID-19. As we started to see some of the cases coming down, and with the introduction of the phased approach that the provinces as well as other healthcare providers are taking, we recognized that we too needed to develop a phased approach. We know that we couldn't open our doors fully the way that we had before, because we do continue to monitor the spread and be able to be responsive. So the phased approach that you're looking at right now, we are currently in phase 1, which we're calling our evolve stage. So we have increased our face-to-face visits for some of our clients. We're continuing to provide our virtual services, so either individual as well as our group offerings. We have over 30 groups that we're offering virtually to our clients in the community. And we are starting to look at how can we open up our buildings so that we can have clients as well as staff return. So we're doing some of that planning right now. It's going to be very similar to what you see when you're going into the grocery stores and other type of community spaces. Is you'll see, plexiglasses around. You'll see stickers on the floors, just reminding people how far to stand apart. So those are some of the things that we're looking at introducing into our spaces. Over the rest of the summer and into the fall, we will be working on planning what we're calling our stabilize and our recovery phase, which is again the next steps to increasing our face-to-face services for our clients, getting our staff and clients back into our office spaces, and really also continuing to look at how we can keep the some of the virtual care that we've been able to provide. There's been so many stories that I've been hearing from clients and staff around being able to engage in groups that they wouldn't typically be able to engage before, or accessing a counselor that they wouldn't be able to access before if they had to come on site. So making sure that the good parts that have come out of COVID-19, which for us is our enhanced virtual care, that we're able to sustain that for our clients and for the community. And then finally, in our recovery stage, yes, we do want to get back to business as usual, back to normal, open up our spaces. On the next slide, I'm going to talk a little bit about the modeling and projection of what could happen for COVID-19 for the rest of this year and potentially into next year. So we do need to think about still controlling the amount of people that we have in our spaces, limiting the number of groups or the number of people in groups. So again, that we can continue to provide physical distancing, but also think about enhancing some of our services on site. We will likely cancel all of our congregate sessions for the rest of the year. So oftentimes we have, I think, the vocational event that comes up in October. We often have all staff events into the summer and into the fall, and those things will be canceled. We will look at potentially doing them in a virtual way. But again, we need to be mindful of the number of people that we're interacting with and having in a confined space at any given time. The phased approach that you see, we've done it this way because there may be a time where the number of new cases increase in our community, and we may need to move back to previous stages to ensure the safety of our clients and our staff. So yes, our hope is that we can continue to move forward into our recovery phase. But there is talk about a second wave, and we want to make sure as an organization that we're prepared that if we do need to go back into our response stage, that we're able to do that quickly and we're able to do that safely for our staff and our clients. So this slide here just really provides just some of the evidence around, why we were thinking about a phased approach. So if you look at this graph here, the purple spike that you see around about 150 days, this is a model that tells us that if we only did physical distancing for 3 months, you would see that the line would be very close to 0. And then as soon as we all stopped physical distancing as a community, you see the spikes go right up off of the chart for the number of COVID cases. The second model that you see, which is this orange line, this model is basically showing us that if as a community we continued to physical distance for a period of 12 months, So, making sure that we're only going out for essential services. We keep our bubble less than 10, so that complete physical distancing. We would do really good as a community until about 620 days, and then it would just spike again. And then the third option that you see there is scenario C, which is the blue kind of squiggly line. This model is based on what they're calling the dynamic physical distancing model. And what this allows is when the cases increase, you enhance your physical distancing. And when the cases decrease, then you let go of some of the physical distancing practices that we've been doing as a community. And what happens is you don't see COVID-19 disappearing, but you see it very steady over a period of time, which is both manageable from our healthcare perspective, as well as making sure that the least number of people are getting sick. So when we look at our plan to return to work, it is based on the physical distancing phased approach, where we can increase our physical distancing if the cases spike, and then we can loosen our physical distancing and our services as the cases decline. So when we're looking at how we move from our phase 1 and our phase 2 is really going to depend on what's happening in our community and what's the capacity of our healthcare system to manage the number of COVID-19 cases. So we know COVID-19 is here for a period of time. I know that they are looking at vaccines and other options to keep people safe. But this is our new reality, and what we're trying to do as an organization is to ensure that we can provide services for our clients in this new reality.
Awesome. Thanks, Lisa.
Good afternoon, everybody. My name is Tajman Graywall. As Lisa mentioned, I'm one of the clinical managers here at CMHA Peel Dufferin. What you see on your screen is how, as an organization, we have responded to COVID-19 and internally some of the changes that we've made to be responsive to the community needs. We have coined the term community response team. As you can see, the flow is where clients will call into CMHA, and we have a team who's assessing the most appropriate service to match the need that you all have, resulting in 3 options that would be immediate. One is access to virtual groups. One is access to a single session immediate counseling for 1 session, and the other is an urgent in-person visit. This service is available Monday to Friday from 8 a.m. to 8 p.m., where you do have immediate access to a mental health worker. We're also, as I mentioned, assessing where clients are going outside of this immediate response if there's any other regular services that are needed, and that could include our rapid access addiction medicine clinic, our assertive community treatment team, our first episode psychosis team, etc. These are all new services, as I mentioned, the groups, single session, and urgent visit. On the next slide, you'll see what access for clients that we have been able to offer. From April to June, you can see that we have been able to connect with 113 new clients. Or the group sessions from April to June, we've been able to offer 282 group sessions, resulting in 1,727 group participants. Additionally, 562 clients have had individual virtual sessions. Our next slide shows other ways and practical ways that we've been able to respond to community and client needs, recognizing that this is a time where in-person support has been shifted to virtual support. We've had donors offer cell phones to clients in order to be able to maintain connection and contact with their worker and other services that they were previously connected with. We continue to offer grocery cards to support your physical health and access to nutritious food. We've also been able to secure volunteer services to allow for food hampers to be distributed to our clients. If you are in need of any of these services or you have additional questions about the services, please don't hesitate to contact your worker.
Awesome. Thanks, Tajman. Okay, so now thinking about what are we going to expect now moving forward from the services that we have with our organization. So we have still that phone support, right? Being able to talk to your worker on the phone, video support as well, using the different technology we have available so we can at least see a face while we're chatting. And there is going to be now in-person support as well, while it is going to be limited and not just always available for whenever we walk in. So we'll talk about that a little bit in the next slide, but thinking also about groups, right? There's a lot of groups that are happening virtually as well, and those virtual groups aren't going to be ending, right? We think it's great that now we can really provide support by groups to a lot of people. Maybe they're not in the area, and so this is a great way for people to be able to be comfortable in their own home and to access groups as well. But we will be starting to think about what groups can we do in person as well, and trying to see what the need is and how we can help people in that way. So if you are interested in groups, the calendars are on our website, cmhapildufferin.ca. So please look and check that out, or speak with your worker. Or if you are familiar with Facebook, the Recovery West program has a Facebook page where everything is posted as well. So if that is something that you are looking into and you know that groups might be something that would be a benefit for you in your mental health journey, please do contact your worker and check out those options. So right now we are not offering walk-in services. So that's going to be continuing, where we're asking that people please don't show up without an appointment. Not that we don't want to see you. We would of course love to see everybody and we wish we could. We are going to be trying to see people as much as possible in this phase. And of course, as Lisa touched on, as the phases continue, hopefully more people, but there must be an appointment so that we know who is coming and we have the appropriate staff that's there, as we're not going to be there every day as well. And so thinking also about the Recovery West program, people are familiar with that. That's going to be something difficult to continue in the way that it was before all of this happened. So right now, congregate gatherings are still prohibited and limited to 10 people. So thinking about that program, it doesn't fit with what it was before. And so we are looking at how we can continue to see people and still following the public health guidance and keeping everybody safe with physical distancing as well. So just a note that please don't show up as much as we wish you could. Please contact your worker or call the main line if you are interested in having an appointment. Some other changes that you will notice, there's going to be a COVID-19 screener. So this is the standard screener questionnaire, and you will be asked this prior to coming in. So on the phone, if you're connecting with your worker about coming in, they're going to provide the screener there asking you those questions. And then again, when you arrive on site, we'll be asking the questions again. Seems like a lot and maybe repetitive, but this is just to ensure the health and safety of everybody that's on site there. There are also going to be, when you do show up, there will be directional prompts. So we'll have a lot of signs showing you which way to maybe walk and directions that we're trying to keep so that there's not a lot of passing of people, so we can keep the distance that way. In terms of transportation, staff are going to provide limited transportation to clients based on the need. So speaking with workers, it's going to be kind of a case-by-case situation with that. And you will see there's a lot of plexiglass barriers at reception as well. So just keeping those individuals who are working our front desk, keeping them safe as well. Some more changes. So we might look a little bit different when you come and see your worker. We might be in full PPE. We might be, or we're definitely going to be wearing a mask. So just recognizing that in that way it will be different. And so maybe you can't see our smiles, but know that we are smiling beneath the mask. So just being aware that that's going to be happening. So yeah, signs as well about safer hygiene. So there's signs that are going to be explaining how to cover your cough, the proper hand washing procedures. Some of those have been there, but maybe some new ones just to refresh our memory as well. So there will be stuff that, I know it's a lot of information and I can't remember it all the time either. So this will help us to all keep on track with that, and there'll be reminders as well. And again, like I said, I was ahead of myself. There are directional signs telling you where to walk, and probably an exit door and an entrance door, and trying to figure that out as well. So we do appreciate that everybody will be adhering to that and being respectful of all that we're doing to try and keep everybody safe, trying to keep you and your families and the community safe, as well as the staff and everybody who's on site as well. So that does bring us to the end of our presentation, and we're going to see if there are absolutely any questions or comments that maybe we need to address. I don't know, Jess or Chantel, if something's come up.
As of yet, we don't have any questions, but definitely we'll let you know if some come in soon.
Awesome. Yeah, so put those questions in the chat. If you still have something that wasn't answered, or maybe you need some further clarification, please put that in. We'll give a couple minutes for people to type that out. And maybe we explained everything and in a great way, and now it's really clear, which would be fantastic. And we know there might be questions too as time goes on, and maybe asking your worker as well. We are working on getting some documents together so that we can provide clients with all the information, as we know you're not going to, I can't remember everything that was said in this presentation word for word. So we want to be able to provide people with that information, which will become available. How are we doing, Jess?
Still no questions, but that's okay. I guess as well, if there's any further questions, you can always follow up with your worker as well.
Definitely, yes. I would say that for sure that will be a good way. And then you'll be able to do some more one-on-one kind of understanding of what it means for you in your specific situation, as well as there are just kind of different limited options for people. Awesome. Well, if there are no questions, I'll take that as we did a decent job at explaining all of that. So again, follow up with anybody if you do need that. And we really appreciate people who've signed on and taken the time to be part of this virtual client town hall. And we hope that everybody stays happy and healthy and safe. And we hope to see everybody soon. Take care.